This is automatic supplies. Basically, you know that we have two types of supplies in clinical trials. One is manual supplies and automatic supplies. Manual supplies is where you select a particular kit type, quantity, and you raise the shipment so that that shipment goes to the particular site. So here automatic supplies are applicable only to the site shipments. We are only considering from depot to site. From depot to depot, we will not do the automatic supplies. This is only for depot to site supplies. Okay. And important thing you need to understand is what is a need at the kit. We call it as kit need. You have to understand what is kit need. Every site will need some kits. The reason for the kits is the kits has to be dispensed to the subject. That's the reason we need kits. The need of kits is known as kit need. Why do we need that? To dispense to the subject. And there are two types of needs. One is a non-predictable need, one is predictable need. So what I mean by non-predictable need is how many kits are needed at a particular site. Such types of needs are known as non-predictable needs, or these cannot be anticipated. One more need is predictable need. So with this need, you can predict how many kits are required of each kit type in a particular site, so that you can send those kits to that site in advance. Okay, that is non-predictable need and predictable need. When we go to the next slide, we will clearly understand what are the different types of non-predictable needs and what are the different types of predictable needs. For example, pre-screening. Pre-screening is a non-predictable need. If you are dispensing any kit in pre-screening and you don't know when the patient comes to the site, that's the reason it is included under non-predictable needs. Yeah, in the same way, screening a new subject, then also you do not know what when the patient comes for the screening new. That's the reason screening new is also included under predictable needs. Next one is treatment assignment. So these are different confusions here, right? When you assign the treatment, it can be enrollment or randomization. So you will have a date, but to which treatment the patient goes, you don't know. So whether he goes to active treatment or a placebo treatment, you don't know. So that's the reason you cannot predict the needs at the site for treatment assignment, whether it can be enrollment or whether it can be randomization. Next one is unscheduled visit. We don't know when the patient comes for unscheduled visit and why the patient comes for unscheduled visit. When the visit is unscheduled, you don't know when the patient comes. That's the reason unscheduled visit is also included under non-predictable need. Then quarantine. So if you quarantine a drug for any reason, maybe you thought that it is out of temperature or it is out of humidity, or you thought that the drug has some damage, then you initially quarantine the drug. When you quarantine the drug, you don't know when the drug can be quarantined. If the drug is quarantined, the drug is not available to be dispensed. That's the reason quarantined is also considered as non-predictable need. And also damage. So you don't know when the kit can be damaged at the site. So if the kit falls from a height, or if the kit is out of temperature and the QA says this kit is not usable, then you have to make it as damaged. If you damage a kit, that is also not, you cannot predict when the kit is going to be damaged. That's the reason even damaged kit is considered as unpredictable need. In the same way, lost. You can lose kits at the site. You can store somewhere and someone can pick it up and throw it away. So many things can happen at the site. So the kits can be lost at any point in time, and you don't know when the kit can be lost at the site. That's the reason even lost is considered as non-predictable needs. Then coming to the what are the predictable needs. So on what type of visits or what type of instances you can predict you need this particular kit at this particular day are known as predictable needs. First one is visit schedule. Scheduled visit. Any visit that is scheduled after randomization. Normally visits are scheduled after randomization. So even before running also we can schedule the visits. But if the visit is scheduled, you know which medicine you have to give in that particular visit, because you know the treatment group, you know the kit type to be given, you know the quantity to be given, you know to which treatment arm the patient belongs. That's the reason scheduled visit becomes predictable need. Even completion comes after randomization and it is a scheduled visit. That's the reason even in completion visits, if you want to dispense, it comes under predictable need. Even follow up, you have a specific follow up day, or you will have a visit schedule for follow up. If you want to dispense on the follow up, so it also comes under predictable needs. Now keeping this in mind, so what is predictable need, what is non-predictable need? Now we will check how do we handle this in the system. So handling this non-predictable needs and predictable needs in the system automatically is known as automatic supplies. This we will do using various strategies. Okay, so we know that we need some kits at a site. Those kits has to be sent automatically. How do we send those kits automatically? There are three types of strategies. So there are two strategies to ensure that the demand for predictable needs is satisfied at the site, and also the demand for predictable needs is satisfied at the site. So in order to satisfy the non-predictable needs, the needs that cannot be predicted at the site for the particular kits are handled through two types of shipment. One is initial shipment and the second one is buffer strategy. Okay, initial shipment strategy and buffer strategy. We apply these two strategies for non-predictable needs. And coming to predictable needs, there is one strategy that we call as prediction strategy. By using these three strategies, one is initial shipment strategy, buffer strategy, and prediction strategy, we can ensure that the site has sufficient amounts of kit uh, well in advance, or we cannot say well in advance, we have to say in time. We have to send the shipment in time, not much before or not much later. So we can ensure that in time supplies to a particular site, so that whoever the patient comes to that particular site have sufficient amount of kits to do randomization or to perform all these transactions which we discussed in the earlier slide. Okay, next we will look into each strategy separately. Yeah, see, by using these strategies we can raise three types of shipment. One is initial shipment, using initial shipment strategy. Basically initial shipment is the first shipment that is sent to the site if it is configured. Okay, and buffer shipment is raised based on the buffer strategy. See, this is an automatic shipment that is sent to the site to satisfy predictable needs. Okay, that is buffer start. So this is non-predictable needs. To satisfy non-predictable needs, you will send a shipment by name automatic buffer shipment to the site. And there is one more shipment, that is a predictable shipment. Based on the prediction strategy, we raise this shipment automatically and send this shipment to the site to satisfy predictable needs at the site. So we will now see how do we raise initial shipment, how do we raise buffer shipment, and how do we raise prediction shipment. Okay, next, initial shipment. Initial shipment means a shipment can be raised. The shipment can be configured and raised. It can be raised at two times. One is whenever the first this is the first shipment to a site. It can be raised uh, by two types. One is site activation. Whenever you activate the site, this shipment can be raised and sent to the site. Next one is first subject screen. When a first subject is screened at a site, then you can raise the shipment and send it to the site. This is initial shipment. This initial shipment is for buffer strategy. So the first activity that is going to happen at a site is site activation. Unless you activate the site, you cannot do anything to the site. You cannot send supplies, you cannot screen, you cannot randomize. The first step that happens at a site is site activation. Once you activate the site in the system, then a shipment is generated. Okay, so we will go to the next topic, that is important thing you have to understand before we go on to the supplies is, so what is site available inventory or kits. Okay, and if you understand this, you can understand rest of the things. First one is site available inventory. To understand this concept, first we have to understand what is usable kit for dispensing. See, usable kit for dispensing, when you can use a particular kit for dispensing. If you understand this, you will understand this. So when a kit is usable for dispensing, it should satisfy some criteria. First one, the kit should be at site. Okay, this is the first criteria. Second one, the kit should not hit D&D. It should not hit the D&D. If the kit hits the D&D, it is not available. It is not considered as usable kit for dispensing. Next one is the kit should not be quarantined, lost or damaged. Okay, if these three criteria satisfies, and also the kit should be in the status of uh, available status, available at site available. So we have site available, right? Site available. So if it satisfies these three criteria, then it called usable kits for dispensing. This is for all the supplies except for automatic supplies. When it comes to automatic supplies, site available inventory is on top of it. See, you are applying D and D. On top of it, if you apply D and C, do not consider concept here, which we have discussed yesterday. If you on top of it, if you add DNC to this, then it becomes site available inventory or kits. So from going forward, now I will be using the word site available inventory. You have to understand site available inventory or kits is usable kits for dispensing. On top of it, when you apply DNC, that is the meaning of site available inventory. Okay, now we will go to the buffer strategy. Buffer strategy is used to address the non-predictable needs at the site. There are two values for it: trigger quantity and resupply quantity. Resupply quantity we are denoting is as X. In further session, we will have the formula. To understand the formula, this is the yeah, this is the alphabet you will use for resupply quantity. For example, I will take a kit, kit type 1. Okay, if I say trigger quantity and resupply quantity, okay, if I give trigger quantity as 5 and resupply quantity as 10, a shipment is raised to the site when the site available inventory, okay, site available inventory, in the previous session we have seen, if the site available inventory is less than 5, a shipment will be triggered. That is known, that's the reason we are calling this as uh, trigger quantity. Okay, this quantity is triggering the shipment. Whenever the site available inventory is less than trigger quantity, so a shipment is raised. What does the shipment contains? The shipment contains uh, more kits. For example, we will give trigger quantity as 5. If the site available inventory for a particular kit type is less than 5, a shipment is triggered. And what does the shipment contain? It will not contain 5 kits. It contains more than 5 kits. It contains 10 kits. So this is known as resupply quantity. Okay, if resupply quantity is 10. But what does the shipment contain? Or what does the buffer demand? We call it as buffer demand, right? Buffer demand is resupply value or resupply quantity, okay, minus site available inventory. For example, think that in this site only there are 3 kits, so now the site available inventory is less than 5, shipment is triggered. What does the shipment contain? Buffer demand. Buffer demand is the amount of kits in the shipment. What does it contain? It contains uh, resupply quantity. This is resupply quantity minus whatever is at site 3. So what is resupply quantity? Resupply quantity is 10, and what is the uh, available site available inventory? Site available inventory is 3. 10 minus 3, that is 7. So when you apply the buffer strategy, the shipment that contains the shipment contains is 7 number of kits. That's the reason this is going to trigger the shipment. That's the reason it is known as a trigger quantity. This is going to determine the how many kits to be included in the shipment. That is the known as, that is the reason it is known as resupply quantity. Final buffer demand is resupply quantity minus site available inventory. This is for buffer shipment. Then we will go for prediction shipment. Prediction shipment is a bit different. Here see, check days, it is giving check days, it is giving restock days. Here we are not directly dealing with the kit quantity. Check days means, for example, for a kit type 1, check days, okay, restock days. What it means is, you have to check for these many days. Okay, if I give check days as 15 days, the system has to check how many kits are required for this 15 days. Okay, from today to 15 days, how many kits are required? From today to 15 days, how many kits are required? It has to check. And if I give restock days as 30, it has to restock the kits for 30 days. This is the check days. This is to raise the shipment. Okay, this is to trigger the shipment. This is to replenish the shipment. Okay, for example, from today to next 15 days, I need 10 kits. Okay, kits in the restock day. Okay, kits in the restock day is Y. For example, if when is the shipment triggered? I have 7 kits at site and I require 10 kits for next 15 days. So I have less number of kits than than the need. That's the reason, if 7 is less than 10, that's the reason shipment will trigger. For how many kits the shipment will replenish? For example, I need 30 days of kits. For 30 days, I need 20 kits. Okay, I already have 7 kits at site and I require 20 kits. 20 minus 7, that is 13 kits. The shipment or the prediction strategy or the prediction demand will have this Y minus Z. Y is kits in restock days and Z is site available inventory. Okay, if you minus site available inventory, this is site available inventory. If you minus site available inventory from the kits in the restock days, that becomes our prediction demand or prediction shipment. This is about prediction shipment. Then every IRT system has to be designed so that it can have each of this parameter or the each of the supply strategy can be worked independently or in combination. So if we want only initial shipment, we can use, it should be usable. If you want only buffer strategy, you should be able to use. And if you want only prediction strategy, you should be able to use. And if you want to combine it, then also you should be able to use it. So next we will check how do we combine prediction strategy and buffer strategy and use it. That is our next slide. When you have buffer strategy as well as prediction strategy, you want to raise the shipment based on prediction and buffer, then what you have to do is resupply quantity. Resupply quantity, you are getting this from buffer strategy, and kits in restock days you are getting from prediction strategy. So first you add the prediction resupply quantity and kits in restock days and minus it from site available inventory. So if you minus that from site available inventory, the shipment you get contains the number of kits needed to satisfy both predictable needs and non-predictable needs at a site. So if you want to use combinedly, this is the formula. If you want to use independently, you can use it. There are various ways of doing it.
Cleangenius Research.